So, uh, a lot of, I hate that the word misinformation has been weaponized also, but there's a lot of misinformation. Gun control organizations have well-funded lots of studies to support their ends. And that comes from the Bloombergs of the world and lots of people, the Moms Demand Action and so forth. And so what they do is they fund studies that do linkages that are basically common sense. Like, well, in this area of the country, we have higher firearm prevalence, and therefore we have higher firearm suicide prevalence. Therefore, higher prevalence of firearms equals higher suicides. Therefore, we should probably try to restrict the firearm access. I'm fine with that. That's true. It's like saying, there's more pools in Los Angeles than there are in Reno. Therefore, there's more drownings. We should restrict access to pools. Well, okay, we could debate how we do about that. We could do education. We could do fencing. We could do all sorts of things, right? What's missing, though, is that in the enactment of these policies that ostensibly are to protect public welfare, and so far as like red flag laws, where if you're struggling, the deputies can come and take your guns for a temporary time, so long as it takes you to get well, or mandatory background checks, or any of that stuff, right? There's a deleterious unintended consequence, and the effect is that people don't want to come into counseling for fear of losing their gun rights. So they don't come into counseling, they ostensibly get worse. What does worse look like? Marriages failing, children being abused and yelled at, jobs being lost, addiction, and suicide. So I'm part of an organization called Walk the Talk America. Walk the Talk America is a 501c3 endeavoring to bridge the gap between firearms ownership and mental health care to get gun owners access to counseling services without the fear of rights restriction. And the reason that's important is because we're a suicide prevention organization at our core. Now, if you look at the pie chart distribution of gun deaths in America, on the whole, nationally, about 60% of all gun deaths are suicides. So that'll vary by geographic region. So if you're in Wisconsin or Wyoming, that number spikes considerably. It goes from 60 to about 70, 75, almost 80% in some places. And if you get down to the county level, sometimes it's 100% because there's one gun death in some rural county in Wisconsin and it was a suicide. But on the whole, nationally, you'll see it fluctuate from year to year. Somewhere between 58 and 62% is suicides. Of all gun deaths are suicides. About 30%, 31% are homicides, and then the rest are negligent or law enforcement caused, whatnot. So if you really want to move the needle on gun deaths and negative consequences of firearms ownership, you really need to hit suicides. And how do you hit suicides other than mental health care? So we're trying to push some positive messaging that says it's okay to talk about being not okay mentally. In fact, it's part of the preparation culture in firearms ownership. The firearms culture is very, very, very diverse, very diverse. It's not just bearded white guy in his 50s wearing camo pants shooting at geese in the plain states. It's your mom in Compton who's single and has 3 kids and wants to protect herself. It's your trap shooting youth. It's your hunters and outdoorsmen. It's your law enforcement. It's your military veterans, service members, and their families. It's a wide variety of people of all political and demographic stripes. In fact, there's 2 clubs, the Liberal Gun Owners and the Liberal Gun Club, that most people would think, well, liberals don't own guns. Yeah, they absolutely do, and they're the fastest growing demographic. So are black people and women. So gun community is very, very diverse. What Walk the Talk America offers for the layperson, but specifically the mental and medical practitioners, is a cultural competence courses. There's a 3-part series, the first 2 of which are available for free on our website, WTTA.org, walkthetalkamerica.org. So we start there. We also offer free and anonymous mental health screenings. That's a polite, arm's length, non-intrusive way for the firearms owners to just check in on themselves. Everybody likes free, and gun owners like anonymity. So free and anonymous mental health screenings, a great way to check in on yourself and see if you need professional psychotherapy or just to take a break or whatever. There's like 14 of them. A couple of them are in Spanish. We also train the firearms community, and we try to demystify what counseling is so that they're less skittish and afraid to come in. Well, flying in the face of all this are some policies that as a 501c3 we can't get involved in too much, but we can educate and we can help people become aware of it. And Mike Sodini, who's the founder, who's a 3rd-generation firearms industry person, he has gone around to lots of these symposiums and discussion forums and whatnot, and he's presented from the firearms community's angle, something other than pride for my cold dead hands. And he says, what you guys ought to understand is that through policies like red flag laws, that in some states like Colorado and New York, where they empower practitioners like you and me and our brethren to enact and effectuate a petition to a judge to take firearms away from an individual who's in a mental health crisis or is a threat to harm himself or others with those guns, it keeps people away from care. And we don't have any of those studies. Bloomberg isn't funding any studies to find out how this negatively impacts suicide rates or mental health concerns. They're only funding the studies that show how often a gun is taken and whether or not it's actually keeping people from death. We don't see the null, though, which is the people who don't come into care because they're afraid of what may befall them. If you think about somebody like a domestic violence survivor who purchases a gun for herself because she's still afraid of her ex, because we all know that people don't respect the paper on which the protection order is written. If she is in counseling and she says that she's, in a bad way, and the counselor isn't competent enough to have a conversation about her gun ownership and maybe what she can do in the temporary time that she's changing medications or whatever, maybe that person pulls the lever, the deputies come knock on her door, they take the gun, and now she's defenseless against the ex who perpetrated the original violence. We don't want to be doing that to people. We don't want to be pushing people away from care. So that's the whole mission of Walk the Talk America, is to educate and elevate. We want alternatives to the government stepping in and taking our property away from us. Debates about due process aside, we're trying to figure out ways that we can do that voluntarily. So through gun shop programs, gun shops will often take in firearms in a time of need, no questions asked. Neighbors, if you're in a state that doesn't require background checks for transferring firearms, you can just hand them off to your neighbor. If you are in a state that requires background checks like Nevada, you could take a non-serialized operable part from the gun, like a bolt or the bolt carrier group or the firing pin, and just stick it in a bag and hand it to your. That's what we're trying to do. And the podcast, as you mentioned, is called Guns and Mental Health. It's available wherever podcasts are found. You just search Guns and Mental Health. And we interview people about these topics, about the suicides that they've experienced, the suicide loss survivors, the mental health struggles that get people in the gun community deal with. We talk about the nexus of things like cannabis being legalized, quote unquote, how it helps people and they still want to own their guns, but federally that's a conflict. We talk one gal doing psychedelic medicine research. We have lots of wonderful conversations about this topic, and we have a handful of practitioners who contribute from time to time on the podcast talking about things of the therapeutic nature. And we also have a or Second Amendment 2A friendly provider directory that we're trying to grow nationally, so that if you are in a tough spot and you need a therapist, you can get one who is going to not judge you immediately for your gun ownership. And my unique story is that I've experienced that myself. I've been in those rooms, in those board meetings, in the community groups where somebody's just talking negatively about guns, disparaging gun ownership. And I'm sitting there, I'm like, I'm right here, right? Wait, no, you don't, because I'm closeted. You don't know that because I haven't told you, because I don't want to tell you, because you're going to not like me for this natural civil right that I'm choosing to exercise, and which is protected by our Constitution. So therapists have to change their minds about that too. We got to get out of the state of mentality that we know everything about everyone all the time and draw judgments accordingly. It's not good. Some stats real quick. Nationally, about 1 out of every 2 people either own a gun or live with one. Locally, wherever you are, that can go up or down. If you're in a big city where there's not a lot of reason to own firearms and maybe the policies don't prevent you from doing so, like San Francisco or New York, it'll be lower. But certainly in rural areas, and if you're in my area, Northern Nevada, it's probably more like 7 or 8 out of 10. But on average, you can reasonably guarantee that 1 out of every 2 people that's going to walk through your door either owns a gun or lives with one. And you can't afford to be ignorant about this topic, especially when suicides are so high and continuing to climb.